This is the eHealth Radio Network, your source for health advice on demand. And now your host, Eric Michaels.
Thanks for joining us once again here on the eHealth Radio Network. This is your host, Eric Michaels. eHealth Radio gives you the most current health information, news, and advice featuring some of the leading innovators in healthcare and wellness who are changing healthcare as we know it. For more eHealth Radio reports, we invite you to visit our main radio channel site at eHealthRadioNetwork.com. Today we're speaking with Karly Rowe, the Vice President of Patient Access, Identity, and Care Management Product for Experian Health. Experian Health works for more than 3,200 hospitals and 10,000 other healthcare organizations, representing 500,000 plus providers to provide data-driven solutions that support revenue cycle management, identity management, patient engagement, and care management. And Karly, thanks so much for joining us here today on eHealth Radio.
No, pleasure to be here. I'm excited to speak with you this morning.
Most certainly, Karly. Thanks so much for your time and looking forward to hearing from you today. So if you would, tell us about Experian Health and your role within the company to get things started today.
Yeah. So Experian Health, as you mentioned, collaborates with hospitals, healthcare organizations, and we provide data-driven platforms to empower our clients to make smarter business decisions. And our industry-leading solutions, right, they span revenue cycle management, identity management, patient engagement, care management. And really my role within the company is figuring out ways to innovate on top of our existing business. How do we use data, those insights to drive new tools, new programs to help our clients either manage components of their operations and their revenue cycle or drive deeper insights to better manage care for patients.
And of course, Karly, any discussion of healthcare today is framed by the COVID-19 pandemic. From your business and your line of sight, what has the pandemic put in the spotlight?
Yeah, over the last year, COVID has really transformed the way that healthcare is delivered and received. The patient engagement and digitization of healthcare have been at the spotlight of COVID and really have challenged the industry to respond rapidly to the very evolving needs. I'll share 4 areas that I think highlight this well from the angle of, vaccination. The segmentation for vaccine distribution is the first. When the vaccine became available, healthcare organizations needed help figuring out how to segment their patient population based on CDC requirements, who was eligible for the vaccine, and they needed to understand if those vaccines were reaching underserved populations and whether, individuals had any social determinants of health barriers that were preventing the vaccine from reaching those hard-to-reach populations. Another area is, the outreach and appointment scheduling. That was very prominent, I think, throughout the early days of the vaccine rollout. Once you've determined who's eligible for a vaccine, how do you engage them? How do you help them get their appointment scheduled? Sometimes if they were needing 2 different appointments, making sure they had the reminders in place and the appropriate tools and mechanisms to engage patients and understand, should that person be reached out via text or direct mail? And, the third piece is around securing those identities, right? Authenticating individuals before giving access to sensitive information or, again, as individuals get vaccinated, having access to view that information on an ongoing basis. And then really for, that fourth component, I would say is making sure that the vaccine reimbursement was kind of optimal for healthcare organizations. As healthcare organizations were trying to understand coverage and how to bill for the administrative fees for the vaccine, even though the vaccine was free of charge, that was an important part of their operations and their cycle for reimbursement as an operational component.
Certainly do appreciate your input and information shared there. Quite interesting as well. Now, in the early days of the pandemic, some of our healthcare organizations estimated 1,800 duplicate records that were being created every 24 hours. So is it a fair bet that the numbers are even greater now as people flock to schedule vaccines? And how does the growing volume of patient traffic challenge our healthcare systems today?
Yeah. Just a few years ago, about 82% of the U.S. population had never even used a remote healthcare service. You fast forward to this past year during the pandemic where, due to COVID protocols and concerns, majority of people began accessing healthcare services remotely. Now, the increased demand for telehealth services really kind of stressed the healthcare industry as a whole as the industry scrambled to kind of figure out services, access, and more importantly, how to synchronize that information back with their traditional healthcare data and their systems, which were from traditionally in-person visits. And while COVID caused the spike in telehealth adoption, I'd say it's a fair assumption that people are now getting more comfortable with technology, and chances are high that that will continue to grow in popularity even after the pandemic ends. But when you think about it, it's really not just the volume that's different, it's also the patient. Many adults will fall into the category of saying, hey, I'm relatively healthy and I really only go to the doctor when I'm sick. Many of those same adults are now going online, scheduling vaccine appointments, and there's a whole new patient population that's kind of flooding the system. And the challenge for healthcare organization comes in when they're trying to determine whether or not that patient exists. Do they have an existing medical record or even a patient portal account? And for that population that, doesn't often go to a doctor or have to interact with a hospital or fill a prescription, they may have opened up a patient portal account years ago, but they're not going to remember that it exists and they're going to create a new one. Or it's even possible that they have a medical record with a particular provider, but life has happened. Life events have occurred, and that caused changes to their identifying information, whether that be their name or their address or other pertinent details that are what healthcare systems use to really match that individual, their identity, to a medical record or patient portal account. And therein lies that challenge, right? Synchronizing all of that information back is quite challenging.
Yeah, it certainly sounds like it, and a lot going on within the healthcare space, and really appreciate what you do there through Experian today. We're joined by Karly Rowe, the Vice President of Patient Access, Identity, and Care Management Product for Experian Health here on eHealth Radio's Healthcare and Health News channels, a part of the eHealth Radio Network. Continuing on, Karly, how would a shift to standardized medical records, possibly even a universal patient ID number, help healthcare systems and health outcomes?
Yeah, so I'll use a concept that most people are probably familiar with, right? Credit. So every time you open a credit card, you get a mortgage, you take out an auto loan, you're opening new lines of credit that get associated to you and tie back to you as an individual, kind of with a unique identifier. And those interactions are what allow you to see a credit report, right? That's compiled based on your credit history and all of those different interactions. In healthcare, there's no way to connect all of your patient information. So when you move doctors, when you move or you change doctors or you fill prescriptions at different pharmacies, all of that information is really important in understanding your healthcare history, and it provides a deeper insight into how to treat you. But that same information isn't accessible to you or to those who are providing care to you. And that isn't because healthcare organizations don't want it. It's just that there's no easy way to get at it, and that's because of the lack of a national patient identifier. So each interaction that a patient has within the healthcare system creates a record, but those records are stored entirely separately within each organization. So your pharmacy, your doctor, your hospital, all of those are storing that information independently. And each organization will assign a different medical record, and they have different medical information associated with you. And they're even likely to have different identifying information about you, depending on what's required, what you've provided, or even how recently you've interacted with them. And so that lack of that consistent national patient identifier, it really means there's no common language across healthcare organizations for them to use to talk about patients. And so, Karly Rowe could be ABC 123. She could be Carly Anderson 789 123. There's no commonality or common language for those for that information to intersect. And so, I draw this kind of analogy, and as consumers today, if we logged into our bank account on our phone or on a computer and we're told, ooh, sorry, we can only show you the money that you deposited last week and nothing else, it would be entirely unacceptable. And that's kind of the state of where healthcare is today. It's, if you log into a portal, you can see what you've seen for the length of the duration of the relationship you've had with that unique organization, but nothing else was connected to it.
Yeah, that certainly is a great example, and it brings to light the issue and the problem here as well. What direction is the industry headed, and what pain points are you solving for as you look to the future?
Yeah, I think it's an exciting time for the industry, and I think out of this pandemic, there will be born a lot of innovation. And so, since I mentioned earlier that this is really transforming the way that healthcare is both delivered and received, it's a great opportunity for healthcare organizations to re-examine or develop their digital front door strategy, which will really define their future for patient engagement. And this is an area that Experian Health has really strong insight into, not only in having developed tools within that area, but also in understanding the patient from beyond the four walls of the enterprise, right? Taking that information, harnessing it, and using it to deliver and customize an optimal patient experience is a huge opportunity. This is a fantastic way for healthcare organizations to really start to think about, how do I change the relationship, the traditional relationship that I've had with my patient? How do I transform that in a new way? I can now interact with them beyond the time that they're in front of me. I can interact with them in multiple touch points and keep them engaged in their healthcare experience. And to me, I think that that's really exciting, and I know Experian Health is actively looking at, how do we continue to help our clients evolve in that journey, right? Evolve in their strategy around that digital engagement and look at how to advance that. It's, brand new relationship for a lot of healthcare organizations, like I mentioned earlier, whether those are existing patients or new patients. And that's a great opportunity to build a stronger message and have people more engaged in their healthcare as a whole, with the intent of trying to keep people healthier, right?
That certainly is the ultimate goal, bringing health to everyone and a healthier lifestyle. Thank you so much for what you do and for joining us here today on the program. I'm sure listeners want to know how they could get more information on Experian Health. Where's the best place to get all the details?
Yeah, appreciate the time and the opportunity to speak with you as well. We have a LinkedIn page, which we can be reached at. We also have an Experian Health YouTube channel, which offers some great insights, interviews with some of our experts and our clients, and we'd be happy to talk with anyone interested.
Some awesome resources to tap into, and we'll leave links accordingly within the show notes of this broadcast to make it more easier and convenient. Again, Karly, all the best, and thanks so much for joining us here today on eHealth Radio. Certainly enjoyed your visit with us here today.
Thank you. Have a great day.
And you as well. We've been speaking with Karly Rowe, the Vice President of Patient Access, Identity, and Care Management Product for Experian Health, that works with more than 3,200 hospitals and 10,000 other healthcare organizations, representing 500,000 plus providers to provide data-driven solutions that support revenue cycle management, identity management, patient engagement, and care management. And for further information, visit Experian.com/healthcare. And again, this has been your host, Eric Michaels, and we do thank you for your continued support of the eHealth Radio Network. Join us again soon for another episode that will help further expand your knowledge on those things that are important to your health and wellness. For more eHealth Radio reports, we invite you to visit our main radio channel site at eHealthRadioNetwork.com. And as always, we do thank you for tuning in.
Thanks for tuning in to the eHealth Radio Network. For more information or to subscribe to this podcast, visit eHealthRadioNetwork.com.